Right, welcome back everybody. Now, test results of a suspected Ebola patient at the Charlotte Maxeke hospital have come out negative. The Department of Health and the National Institute for Communicable Diseases made the announcement yesterday after the man reported to his doctor with a fever. The South African man had been working as a health and safety officer in a mining operation in Liberia. To tell us more, we are joined by Professor Lucille Blumberg. She's the Deputy Director in the Division of Public Health Surveillance and Response at the National Institute for Communicable Diseases. Thank you very, very much for being with us. It's always a pleasure chatting to you, Professor.
Thank you.
Okay, so this patient doesn't have Ebola. And there is nothing to worry about at that stage here in South Africa.
We have no cases. I think we're at low risk of importation of cases, and there's a lot in place to detect any cases quite quickly and respond appropriately.
Okay. Now, in terms of this particular patient and the previous patient, why was there an emergency reaction towards them?
Well, I think a very important response is to identify people who've travelled from the outbreak area, who've got, at the time, an unexplained fever, and to consider testing. Neither patient had had direct contact with the Ebola patient, so I think their consideration for Ebola was really quite low.
Yeah.
But it's important to test the system, and I think the system actually worked very well.
Okay, so these two patients that came in, they basically had fevers.
They had fever, they'd been in the outbreak area, and there wasn't a very quick reason that we could identify for that fever.
And what was the diagnosis? Is that something you could share with us?
Well, the first patient was pregnant, subsequently delivered a healthy baby, and I think turned out to be a urinary tract infection.
Okay.
But because there was an anticipation that there could be a cesarean section and lots of blood around, I think to create some confidence in the system for nurses, I think it was reasonable to do the test.
All right. And our second
patient, we don't have a confirmed diagnosis yet. He's very stable, and we've excluded Ebola as a cause.
All right. Okay, let me ask you. I know you've already said it, but let's just put South Africans' minds at ease at this point. Are you satisfied with, if there is a case of Ebola in our country and say one of these patients did come to you and they did have Ebola, do we have enough to cope with this? Can we deal with it?
I think there is a lot in place. You know, we've dealt with viral hemorrhagic fevers over many years in this country. So there are a lot of systems that are set up. The most important is for health workers, doctors, nurses to consider Ebola in people returning from the outbreak area, the 3 countries, who've got fever, and then to think about Ebola and look at excluding it, either on questioning or if testing is needed, that should follow.
All right, so how do we protect ourselves from getting Ebola, just as a matter of precautionary measures?
I think it's to identify any imported cases quickly and to contain any potential spread. I think that is the most important intervention. And I think the risk of importation is low.
So it is low. I mean, it's not, like you say, it's not an airborne disease. So it's not something that if I sneeze, you're going to get it.
No.
It's not as simple as that. How do you get Ebola?
You need to handle with bare hands organs, blood, feces of patients with the disease. So that happens in the outbreak areas where people are being cared for at home by their relatives, where there's preparation for funerals, where people are handling the bodies again, and in the health facilities where, because of just being under-resourced, healthcare workers are looking after patients with bare hands.
Yeah. But if for instance, you are traveling, and I mean, let's put it this way, say somebody does manage to get onto a flight that does have Ebola and you are sitting next to this particular patient.
There is no risk whatsoever.
There is no risk. Nobody on that plane is going to get it.
No, unless they vomit and you handle the vomitus. That would be the only risk. Not by sitting next to them, definitely not airborne.
Okay.
And actually in aeroplanes there's some very good systems for purification of air, but it's not airborne.
Okay, so why is it that especially the World Health Organization is really being strict on screening at airports, at seaports, at different travel destinations?
So I think it's one of the recommendations to pick up cases early, but there need to be other systems. And the chances of somebody coming through with fever at the time, being picked up at an airport, are quite low. So you need the other systems in health facilities to consider Ebola in patients.
Yeah.
Really, the major risk of infection and travel in that area or Africa is malaria. and you can prevent that.
Okay. Now, I know, just finally, before I let you go, there is a team from our National Communicable Diseases Institute that's actually gone to Sierra Leone. Tell us about the work they're doing there.
So they arrived yesterday safely. They will set up a mobile laboratory that allows them to process samples with great care safely from patients with suspected Ebola. And I think they will do a wonderful service and make a huge contribution to outbreak management. Yeah,
indeed. Well, keep us updated on that. Thank you very much for coming in and just updating us. And I know it's one of those things where people are just worried, because it's a frightening thing to be watching what's happening on our continent, with so many people dying from this disease.
Yes.
And it just seems this outbreak it's almost uncontrollable.
I think in particularly Liberia, the outbreak is completely out of control, but it's in the area. Yeah. And I think the risk to South Africa remains very low. There's lots of systems in place.
Good. Professor Lucille, thank you very, very much. Lucille Blumberg is from the National Institute for Communicable Diseases, talking to us about the Ebola outbreak and the risk here to South Africa. And as you've heard, there is at this stage no risk to South Africa, and getting this particular Ebola virus is very, very difficult. You have to really be in contact with anybody that does have it, and it's through fluids that you get it, not airborne. So just allay those fears. All right, thank you. Let's take a break.